For those suffering from Crohn's disease, simple activities that most people take for granted may seem monumental. The ongoing fear of emergency runs to the bathroom can prevent a person from participating in normal, enjoyable daily events like going out to dinner, taking in a movie, or attending a live sporting event. However, proper planning can help improve these scenarios to some degree.
Some of the things that my patients tell me is that they're very aware of all the bathrooms that are on the road on their way to work, and they're very aware of all the restrooms when they go to a restaurant or when they're out. And I understand that it's a way that they've had to lead their lives. My hope and my expectation is as they get better and stay in remission for a longer period of time, they'll need to be less cognizant of where every bathroom is. Nevertheless, I understand that adaptation that they've made to their lives. I also encourage them, if they feel a little safer, taking an extra pair of underwear on their way to work, as a safety net. That's understandable. I encourage them to get up earlier in the morning than they otherwise might so that they can have their bowel movements at home and feel safe on that drive to work. The other situation that I find my professional patients getting into trouble with is flying. When you're in an airplane, gases distend in the air, and it's no different in the intestine. So patients that have Crohn's disease should avoid having heavy foods on the planes and avoid having carbonated drinks when they're flying, and therefore they might have less abdominal pain when they get to wherever it is that they're going.
While practical planning may help for any given activity, the cumulative frustrations of day-to-day life with the condition can take both a physical and emotional toll on the patient.
Even though the majority of patients with Crohn's disease have a normal lifespan and normal quality of life when they are well, their wellness can be interrupted by flare-ups, and flare-ups of abdominal pain, diarrhea, or bleeding interfere with their ability to go to school, to work, to have their daily sports activity, or even to interact with their families or loved ones.
Crohn's can have a devastating impact on people's psychological state, and it's understandable that people with chronic illness can be debilitated by that, but in particular in our society, people don't want to talk about diarrhea or having abdominal pain or going to the bathroom. There are many other sexier diseases that people can complain to their friends about, so they're reluctant to share it with friends. So they're internalizing it. They're not telling their friends about it. Many of their friends are not going to know what Crohn's disease is, so it's not an expression that you could use in a group of people and have them understand what it is. And so I think we need to be aware that depression can occur in patients with Crohn's disease. There's no reason not to treat it. Most of the medications that we use to treat depression have no contraindication in people who have Crohn's disease. So we as doctors need to recognize that, and patients need to be open to telling us not just about their gut symptoms, but how they're feeling psychologically.
To assist with the emotional challenges of the disease, many people will join support groups where they can spend time with other people who fully understand what they are going through.
Successful treatment of Crohn's disease requires a team approach that not only involves the patient and their doctor, but an entire team of individuals that includes family members, the doctor's healthcare team, which may include nurses and psychologists and social workers, of course, surgeons, radiologists. There's a large group of people that work together to take care of Crohn's patients. But I also think patients benefit greatly from support groups, from talking to other people who have the same disease, especially for a disease in which it has a social stigma associated with it, a disease that involves the bowel, where it's not as easy to talk to other people about the disease. Being in a group of people, being with a group of people who have that disease and sharing stories about what doctors they like, what therapies have worked, learning about new research and new and exciting approaches to treatments can be extremely therapeutic, but so can understanding how the disease has affected others so that you have a perspective on what this is doing.
In addition to real-world support groups, a growing number of patients are going online to share their stories, learn from others, and continue their own research on the condition. For many, the first stop is the Crohn's and Colitis Foundation.
Since there is a growing number of patients diagnosed with Crohn's disease, there's a greater need than ever before to have a credible source of information like the Crohn's and Colitis website. On that website, professionals, patients, and caregivers can find information on diagnosis, on treatment. They can find brochures and fact sheets that they can download and print in their homes. They can find videos that they can download and view later. In addition, we have another website, a sub-website of our site, where teens can visit and find information about what it's like to be a teenager living with Crohn's disease or colitis. They can interact with one another, build relationships, and generally build some self-esteem, because it's important for teens particularly to learn that other teens are feeling the same way about their disease.
Even though the wealth of online information the Crohn's and Colitis Foundation provides is significant, it is just one aspect of the organization's contribution to patients and caregivers.
Some of the features and benefits of the Crohn's and Colitis Foundation include educational programming and patient services that's conducted both on a national and a chapter level. We have some 32 chapters around the country that conduct support groups. We have over 300 support groups nationally where patients can meet patients and talk about their disease. We have educational programs that occur in all 32 of those chapters where patients can meet the doctor or meet the healthcare professional and talk about their disease and what it is they need to know about that disease, and also learn a lot about some specific area of their disease. On a national level, we'll often do conference calls where we'll pick a subject relative to Crohn's or colitis, and patients from around the country can join that call and ask questions of those experts. Additionally, we have an information resource center at our national office that is staffed by 2 public health professionals, and a patient can call whether they're newly diagnosed, whether they're suffering with symptoms and they think they may have a digestive disease like Crohn's or colitis, or they're a patient who has had the disease for years and just needs new information and be updated on what available treatments are out there.
While the information found online may be valuable, it is important you follow up with your physician to confirm any data and to ask appropriate questions prior to making any modifications to your current treatment plan.
Most patients with Crohn's disease will use the internet as one of their resources to learn more about their disease and about available treatment options. When people do that, it's extremely important that they look at a reputable website and that they check the information with their doctor. So if they look at a website and it recommends specific therapies or specific diets, it's important that they then talk to their doctor about how they might want to change their therapy or the ways in which this might affect the existing therapies and how it might affect their disease.
Crohn's disease patients really should try to educate themselves, and the internet could be a really good source of information for people with Crohn's disease. One of the problems that I see with it, though, is that some of the sites can present an extreme case of Crohn's disease that might not be applicable to the individual. So I have patients coming to see me that have really read things that can be frightening, whether it's frightening about what can happen with Crohn's disease or frightening about some of the side effects of the medication. I just ask that when people read these websites, they keep an open mind and understand that the physician could also provide a more rational perspective on what one can expect from having Crohn's disease.
And that brings us to the end of our program. On behalf of the staff at healthXplorer, we would like to thank you for taking the time to watch this presentation. We hope the information we've provided has helped you gain a better understanding of Crohn's disease. We'd like to remind you that every patient's case is different. And whether you're someone that has been newly diagnosed or whether you have lived with the condition for years, modern medicine is constantly striving to provide options to improve your quality of life. It is important that you work closely with your physician to tailor the best treatment plan for your unique situation. In the end, we hope that you reach a successful level of Crohn's disease management so that you're able to live your life the way you want to, not the way your condition mandates. Thank you, and good luck.